Dental health is very important. Let's have a conversation. Mouth and tooth infections can become dangerous more quickly than expected due to the unique anatomy of the oral cavity and its close connection to vital structures. The mouth harbors a dense population of bacteria that can invade deeper tissues when protective barriers are compromised. Once established, infections may spread through blood vessels, adjacent anatomical spaces, or bone, leading to serious complications such as sepsis, airway obstruction, or deep facial infections. Involvement of key structures like the masseter muscle further signals progression beyond a localized dental issue. Early recognition and treatment are critical to prevent escalation and systemic consequences. Body, mouth, and tooth infections pose significant risks because of both the high bacterial load within the oral cavity and the pathways available for infection to spread. The mouth naturally contains hundreds of bacterial species. When a tooth is compromised by decay, fracture, or gum disease, these bacteria can penetrate deeper tissues and form an abscess, a localized collection of pus that can expand aggressively if untreated. The surrounding tissues are highly vascular, allowing bacteria to enter the bloodstream and disseminate throughout the body. This can result in systemic conditions such as sepsis or infective endocarditis, demonstrating that a localized dental issue can evolve into a life-threatening condition. Anatomically, teeth are located near critical structures including the brain, sinuses, and airway. This proximity enables infections, particularly from upper teeth, to spread into these regions, potentially causing brain abscesses, sinus infections, or airway compromise. One severe example is Ludwig's angina, a rapidly progressing infection that can obstruct the airway due to swelling in the floor of the mouth. Additionally, untreated infections may extend into the jawbone, resulting in osteomyelitis, a serious condition that is difficult to treat and may require surgical intervention. A key challenge in identifying the severity of dental infections is that pain does not always correlate with disease progression. In some cases, pain may temporarily subside when the nerve within the tooth dies, even as the infection continues to spread into deeper tissues. This can lead individuals to underestimate the seriousness of their condition. Furthermore, dental infections can escalate rapidly, sometimes progressing from a mild toothache to a severe infection within days, particularly in individuals with weakened immune systems or when treatment is delayed. Warning signs that require urgent medical attention include facial or neck swelling, fever, difficulty swallowing or breathing, and systemic symptoms such as fatigue or confusion. The involvement of the masseter muscle provides additional insight into the spread of infection. This powerful muscle, located along the side of the jaw, plays a primary role in chewing and jaw closure. When infections from lower molars extend into surrounding tissues, they can irritate or inflame the masseter, leading to trismus, commonly known as lockjaw. This condition is characterized by difficulty opening the mouth and pain with movement, and it often serves as an early indicator that the infection is no longer confined to the tooth. Beyond muscle spasm, infections can spread into adjacent deep facial spaces, resulting in conditions such as masticator space infection. These infections may cause swelling along the jaw and cheek and can extend into deeper regions of the head and neck, making them more difficult to diagnose and treat. Inflammation of the masseter can also produce significant pain during chewing and noticeable swelling or firmness along the jawline. Importantly, involvement of this muscle indicates a transition from a localized dental problem to a more complex and potentially dangerous infection requiring prompt medical or surgical management. In summary, tooth infections are dangerous not because of the tooth itself, but because of their ability to spread rapidly to vital structures and systems. The combination of high bacterial load, vascular access, and anatomical proximity to critical regions creates a pathway for serious complications. Early dental evaluation and treatment remain essential in preventing progression and protecting overall health. We hope you enjoyed the video. We are on the road to 500,000 subscribers. Please join us for the journey.